This lecture will cover 3 systemic diseases that result in multiple pancreatic cysts. While you are studying these diseases, make sure to pay attention to what the disease is, how it's inherited or how it is acquired, and how it presents itself. If there's anything that sticks out to you about the disease, it'll be important to remember that as well. Use the forward arrow to move to the next slide. If you're using PowerPoint to view this presentation, make sure to open it in the slideshow mode. As you are navigating through the slides, you will see a pancreas icon. Click on it to hear more about the subject. YouTube users, the video will automatically play all sounds and key link terms. Autosomal dominant polycystic disease is kind of an overarching disease process. You will quite often hear autosomal dominant polycystic kidney disease, and you can also have polycystic liver disease. When there are multiple organs affected, then we call it just autosomal dominant polycystic disease. There is not a polycystic pancreas disease. It falls under this broad category. When the pancreas is affected by autosomal dominant polycystic disease, there will be multiple cysts presenting on the pancreas. They can be microscopic to very large, and you will also most likely see cysts within the liver and on the kidneys. Von HippelLindau syndrome is another inherited disorder, and what happens with von HippelLindau syndrome is that the patient is more likely to develop both cysts and tumors. And so the cysts can pop up in any organ, including the pancreas, and then the tumors are going to be solid and typically are benign but have potential to become cancerous. And those are most likely going to be in like the brain, spinal cord, eyes, something like that. Those tumors are called hemangioblastomas, and they're typically made of newly developed blood vessels. For patients that have von Hippel-Lindau syndrome, they also are at a higher risk for developing neuroendocrine tumors of the pancreas, which we'll talk about on another lecture. The cysts that appear with von Hippel-Lindau syndrome will most likely be well-defined cysts. They can have a little bit of a thicker fluid appearance to them, and some of them can even present with calcifications. The size varies from small to very large. Cystic fibrosis is another disease that can present as benign cystic pancreatic lesions. Cystic fibrosis is an inherited disease and typically is going to affect parts of the body that are responsible for creating either mucus, sweat, or digestive juices. So we commonly think of cystic fibrosis and the lungs because the lungs are producing that mucus, and then they have to have the shaky vest where it kind of shakes out those mucus plugs so the patient can cough them up. But it also affects, again, those areas that also create sweat and digestive juices like our pancreas. So the pancreas can be affected by cystic fibrosis. What ends up happening is that the fluids that the organ creates end up becoming very thick and sticky, and then they kind of create these plugs. On ultrasound then, cystic fibrosis is going to present as multiple cystic spaces, and what those cystic spaces actually are the mucus plugs that have formed within the pancreas. We might also see some calcifications within the pancreas, and there might be a little bit more fatty tissue, which would make the pancreas more echogenic.